Picture this for a moment. You wake up one morning feeling perfectly fine, you make your tea, open the curtains, and enjoy the quiet. Then out of nowhere it starts. A strange tightness in your chest. It's not sharp, just uncomfortable. You tell yourself, maybe it's indigestion. You take a few deep breaths, hoping it will pass. But it doesn't. Now your left arm feels heavy. You start to sweat. You reach for your phone, but your hands are trembling. And suddenly the reality hits you. You might be having a heart attack and you're all alone. It's a terrifying thought, isn't it? Yet for millions of seniors living alone, this situation is far more common than you might think. According to the American Heart Association, nearly half of all heart attack deaths happen before a person ever reaches the hospital, often because they didn't know what to do in those first few critical minutes. The truth is, surviving a heart attack alone isn't about luck. It's about knowledge, calmness, and preparation. And that's exactly what this video will give you. Today we'll walk through 7 life-saving tips that every person over 60 should know. Simple, science-backed steps you can take if a heart attack strikes when no one's around. These aren't gimmicks. They're practical, medically informed actions that could keep you alive long enough for help to arrive. And if you stay until the end, I'll share a quick, 2-minute checklist you can keep near your bedside, something that could save not only your life, but someone you love. Before we begin, please remember this video is for educational purposes only and should not replace professional medical advice. Always consult your doctor about your personal heart health and any emergency plan that's right for you. Alright, let's start by understanding what's really happening inside your body during a heart attack, because when you know what's going on, you'll know exactly how to respond. To survive something, you first need to understand it. So what is actually happening inside your body during a heart attack? A heart attack isn't just sudden pain or pressure, it's your body crying for oxygen. Your heart is a muscle, and like any muscle, it needs oxygen-rich blood to work. But when one of the arteries that feeds it becomes blocked, usually by a buildup of fat, cholesterol, or blood clots, that flow is cut off. When the heart doesn't get oxygen, even for a few minutes, its muscle cells begin to die. That's what a heart attack is. Not a random event, but the heart quite literally suffocating from the inside. The longer that artery stays blocked, the more damage occurs. That's why acting fast, within the first few minutes, can make the difference between full recovery and permanent heart damage. Here's what's tricky. Heart attacks don't always look or feel the way we expect. Many seniors never experience that dramatic movie-style chest pain. Instead, they might feel fatigue, indigestion, dizziness, or even pain in the jaw, back, or shoulders. For women over 60, symptoms can be even more subtle, maybe just shortness of breath or an unexplained sense of unease. And that's why many people wait, hoping the feeling will pass. But every minute of waiting allows more heart tissue to suffer. The sooner you recognize that something isn't right, the sooner you can take action that saves your life. Your body is incredibly smart. It gives early warning signals, small ones that often go ignored. You might feel lightheaded, break out in a cold sweat, or feel pressure spreading to your arm or neck. Some people describe it not as pain, but as a weight on their chest, or a feeling that they just can't get enough air. When you know these signals, you don't have to panic. You can prepare. Think of it like your car's warning light turning on. It's not there to scare you, it's there to help you act before it's too late. After 60, our arteries naturally stiffen. Years of wear, high blood pressure, or high cholesterol can quietly narrow those blood vessels. Add stress, poor sleep, or dehydration, and the heart can suddenly be pushed past its limit. That's why older adults are at higher risk, but it also means awareness is your best protection. You can't control your age, but you can control how you respond when every second counts. Now that you understand what's happening inside your body, let's talk about what to do the moment those symptoms strike. The first 60 seconds that could save your life. When a heart attack strikes, every second matters. Those first 60 seconds can decide whether you live long enough for help to arrive. So let's walk through what you must do, calmly, clearly, and step by step. The very first thing, and the most important, is to call emergency services immediately. Don't second-guess it. Don't wait to see if the pain goes away. Every minute you delay increases your risk. In the US, that's 911. In the UK, 999. In Nigeria, 112 or 767. Wherever you live, memorize that number, or write it near your phone. If you have a smartphone, Say "Hey Siri" or "Okay Google, call emergency." You might not have the strength to dial, but your voice can still save you. And if you're alone, put the phone on speaker. That way you can still talk and follow instructions while staying as still as possible. If you live alone, your next step is to make sure rescuers can reach you. Unlock your front door, or at least unlock the main entrance. If you pass out before they arrive, a locked door could cost precious minutes. Try to stay near an entrance or an area where you'll be easily visible. These small preparations might sound simple, but they can save vital time when every heartbeat counts. Next, sit down calmly. Don't lie flat, and don't try to walk around. Lying flat makes the heart work harder, while moving can strain it even more. Sit upright with your back supported, maybe against a wall or chair, and keep your upper body elevated at about a 45-degree angle. This helps blood circulate more efficiently. Place your phone beside you, keep breathing slowly, and focus on staying calm. Fear and panic release stress hormones that can make things worse. Next step, take an aspirin, but only if it's safe for you. If you're not allergic and your doctor has previously approved it, chew one regular aspirin, about 325 milligrams. Don't swallow it whole. Chewing helps it absorb faster into your bloodstream, thinning the blood and reducing clot growth. If you're already on a prescription blood thinner, skip this step unless your doctor has specifically said it's okay. Remember, aspirin doesn't stop a heart attack, but it can slow the damage while you wait for help. Step 5. Control your breathing and loosen clothing. Take slow, steady breaths, in through your nose, out through your mouth. This helps control panic and maintains oxygen flow to your heart and brain. Loosen any tight clothing. Unbutton your collar, loosen your belt, or remove anything restricting your breathing. If you start to feel lightheaded, focus on slow counting. Breathe in 1, 2, 3, breathe out 1, 2, 3. Keeping your breathing steady can help prevent fainting. Step 6. Stay on the line and follow instructions. Don't hang up the phone. Stay connected to emergency responders. They're trained to guide you through those critical minutes, even if you begin to lose strength. If possible, describe your symptoms clearly. Chest pressure, shortness of breath, sweating, dizziness. The more they know, the faster they'll act when they arrive. Finally, remind yourself, you've already done the most important things. You've called for help. You've taken aspirin. You're staying calm. Now it's about holding on, minute by minute, until help arrives. Let's talk next about what to do if you start feeling faint or your vision begins to fade, and how to keep yourself alive even when you feel you might lose consciousness. Now let's talk about what to do if you begin to feel faint, if your vision blurs, your breath shortens, or your body starts to feel heavy. These moments are frightening, but remember, you're not helpless. There are still things you can do to keep yourself alive until help arrives. Before you lose full strength, pay close attention to your body. Common signs that you might be slipping toward unconsciousness include sudden dizziness, tunnel vision, ringing in your ears, or a feeling that the room is spinning. The instant you feel these, act, don't wait. Move as little as possible, but position yourself safely. If you're standing, sit down immediately. If you're already seated, slide down to the floor with your back supported. This way, if you pass out, you'll avoid hitting your head or losing blood flow completely. When oxygen to the heart is low, your breathing may become fast and shallow. That only makes it worse. Try to switch to slow, deep breaths. Inhale through your nose for 3 seconds, hold for 1, exhale through your mouth for 3 seconds. This helps stabilize your heart rhythm and keeps oxygen flowing to your brain. Think of each breath as sending a message to your body. Stay calm, stay alive, help is coming. You may have heard of something called cough CPR, advice that says to cough hard to keep your heart beating. Let's set the record straight. Cough CPR is not a substitute for real CPR or emergency care. It's sometimes used in hospitals under medical supervision when a patient's heart rhythm is being monitored, but at home it's not safe to rely on it. For some people, coughing can actually make the heart rhythm worse. Instead, focus on steady breathing and keeping your body positioned safely, sitting or slightly reclined, head supported, and airway open. If you have a smartwatch or smartphone nearby, use voice commands "Hey Siri, call 911, or OK Google, call emergency. You can even say, "Text my daughter, I need help." These devices can detect movement or lack of it. Some even alert contacts automatically. That's why keeping your phone or wearable within arm's reach, especially at night, is more important than most people realize. Finally, remind yourself, this will pass. You've called for help, positioned yourself safely, and controlled your breathing. Each slow breath, each second of calm, keeps oxygen flowing and buys you time. Don't focus on fear, focus on survival. Help is already on the way. Now that you know how to keep yourself stable in the worst moments, let's take a step back. The next section will show you how to prepare before a heart attack ever happens, so you're never caught off guard again. We've talked about what to do during a heart attack. Now let's take a step back, because the best survival strategy is preparation. The truth is, most people don't think about what they do until it happens, and by then it's often too late. Preparation doesn't start at the hospital, it starts at home. Just as we plan for a fire or keep spare keys, every person over 60 should have an emergency heart plan. Think of it as your life map for when seconds count. Here's what to include: emergency numbers written clearly near your phone and fridge, your current medications and dosages listed on a card, medical conditions and allergies in large, easy-to-read print, a copy of your ID and insurance card in a small envelope labeled emergency info. Keep this somewhere visible, on the fridge, by the bed, or next to your phone. Paramedics often look there first. Today's technology can be your silent guardian. Smartwatches and medical alert devices can detect irregular heartbeats, falls, or sudden stillness, and automatically contact help. If you live alone, consider devices like smartwatches with heart monitoring, medical alert pendants that call for help with one button, voice-activated assistants like Alexa or Google Home for hands-free emergency calls. Even if you're not tech-savvy, a simple device can mean the difference between life and death. A heart attack doesn't wait for convenience, so make sure the things that can save your life are within arm's reach. Especially if you live alone, keep a small pack of aspirin by your bedside, in your purse, or on the kitchen counter. Have your phone charging near your bed, never out of reach. And always keep your doors unlocked or a key accessible if you ever feel unwell. Little adjustments like these might seem small now, but in a crisis they become everything. Preparation isn't only about emergencies, it's also about prevention. Heart problems build up silently over years, so regular checkups are your best defense. Make sure you're getting blood pressure checks every few months. Cholesterol and blood sugar tests at least once a year. Electrocardiograms, EKG if you have chest discomfort or an irregular heartbeat. Ask your doctor what your personal risk factors are, because everyone's heart story is different. And remember, taking charge of your health doesn't make you weak. It makes you wise. A strong heart isn't built in emergencies, it's built in everyday moments. Here are small, powerful habits that protect your heart. Eat foods low in salt and processed sugar. Include fruits, vegetables, and omega-3 rich fish. Walk for at least 20 minutes a day. Movement keeps blood vessels flexible. Stay hydrated. Dehydration thickens your blood and strains the heart. Get 7-8 hours of sleep. Your heart repairs itself while you rest. These simple acts don't just prevent heart attacks, they build the strength that helps you survive one. Finally, don't face this alone. Tell your family, friends, or neighbors where your emergency info is. Share your plan with them, because the more people who know, the faster help can reach you. You're not being a burden, you're being proactive. And that's one of the most loving things you can do for yourself, and for them. Now that you know how to prepare, let's talk about the mental side. How to stay calm, overcome fear, and build the emotional strength that keeps you steady when life feels fragile. Fear. It's the one thing that can make any situation worse, especially during a heart attack. Your heart starts racing. Your mind says this is it. And that panic can actually make the heart work harder. But here's the truth. Calmness isn't just peace of mind, it's a survival skill. The calmer you are, the more oxygen your heart receives, and the clearer your decisions become. If you've ever felt afraid of being alone, or worried about your health, you're not weak, you're human. Every heartbeat carries decades of memories, people you love, moments you've lived through. It's only natural to fear losing that. But the goal isn't to remove fear completely, it's to train your mind to act through it. Just as fire drills teach us what to do in an emergency, mental rehearsal can teach your brain calm. You can prepare your mind just as you prepare your medicine cabinet. Try this. Every morning or night, close your eyes and take 5 slow, deep breaths. Inhale peace, exhale fear. Picture yourself in control, Calm, steady, calling for help, taking your aspirin, breathing slowly. This mental rehearsal builds muscle memory. So when an emergency strikes, your brain says, "I've been here before." You'll act instead of panic. When your mind says, "I'm scared," answer it with, "I'm prepared." When it says, "I can't do this," remind yourself, "I know what to do," because preparation gives you power. You've learned how to recognize the signs. You've learned what to do in the first 60 seconds. You've learned how to stay alive until help arrives. That knowledge is your armor. Confidence doesn't come from being fearless, it comes from being ready. Every heartbeat you feel right now is proof of strength. You've survived challenges before, loss, pain, loneliness, and yet you're still here. Don't let fear isolate you. Let it motivate you to walk a little more, eat a little better, share your plan with a friend, and live with awareness instead of anxiety. Your story doesn't end with a heart attack. It continues with wisdom, courage, and calm, because you've learned how to face the unknown and win. You've learned how to stay calm, prepare, and act if you ever face a heart attack alone. But there's one last truth you must remember. Survival begins before the crisis. Your body often whispers long before it screams. Listening to those whispers can save your life. Many heart attacks don't begin with dramatic chest pain like in the movies. In fact, especially after 60, the signs can be subtle and easy to dismiss. If you notice these symptoms, see your doctor immediately. Mild chest pressure or discomfort that comes and goes. Shortness of breath during light activity or at rest. Unexplained fatigue or weakness that lasts for days. Dizziness or lightheadedness. Pain spreading to your neck, jaw, shoulders, arms, or back. Sweating for no reason. Especially cold, clammy sweat. Don't wait until the pain is severe. Many lives are lost in those first few hours of denial. Did you know some heart attacks happen without crushing pain at all? These are called silent heart attacks, and they're more common in older adults, especially women and people with diabetes. The symptoms can look like ordinary fatigue, indigestion, or flu-like discomfort. You might feel nauseous, short of breath, or just off. If something feels wrong and you can't explain it, don't brush it aside. Trust your instincts. Call your doctor or emergency services. There are times when hesitation can cost a life. Call emergency services immediately. If you experience any of the following: sudden crushing or heavy pressure in your chest that lasts more than a few minutes, pain radiating down your arm or into your jaw, sudden shortness of breath, even if you're sitting still, fainting, collapse, or confusion, rapid or irregular heartbeat that doesn't slow down. Don't drive yourself to the hospital. Call an ambulance. Paramedics can start treatment before you even arrive. When you do see your doctor, share the details clearly. Write them down if needed. Explain when the symptoms began and how long they lasted, what you were doing when they started, any new medications, stress, or diet changes. Family history of heart disease. The clearer your story, the faster your doctor can help. Here's the hopeful part. Most heart attacks can be prevented or survived with timely action. Seeing your doctor early isn't a sign of weakness, it's a sign of wisdom. Because your life isn't defined by fear, it's defined by how quickly you respond to protect it. You've just learned something most people never take the time to understand: how to survive a heart attack alone. You've faced your fear, you've learned the facts, and now you hold the power to save your own life. It's not about living in fear of what could happen. It's about living with the confidence that if it does, you'll know exactly what to do. Let's bring it all together. The 7 lessons that could save your life or someone you love. 1. Understand what's happening inside you. Know the signs and never ignore your body's warnings. 2. The first 60 seconds matter most. Stay calm, call for help, and take that aspirin if advised by your doctor. 3. Use self-help techniques if you start to lose consciousness. Cough or take slow, deep breaths to keep blood flowing, and focus on staying alert. 4. Prepare before it happens. Keep emergency info, medication, and phone access within reach. Technology and readiness save time, and time saves lives. 5. Strengthen your emotional heart. Practice calmness daily. Replace fear with confidence. You're stronger than you think. 6. Know when to see a doctor. Never wait. Never guess. Seek medical help early. It's the smartest move you can make. 7. Choose life. Every day, Eat better, move more, sleep well, and cherish each heartbeat, because every one of them is a gift. Maybe you're watching this because you've already had a scare, or because you live alone and wonder what would happen if something went wrong. Take a deep breath. You're not powerless. You've taken the first step just by learning. And that step can make the difference between panic and peace, between fear and survival. Remember, preparation isn't about expecting the worst. It's about being ready for life. It's about valuing yourself enough to say, I matter, and I'm prepared. So, promise yourself this. From today, I will listen to my body, I will stay calm in crisis, I will prepare, not panic, and I will keep living fully, with gratitude, not fear. If this video helped you, share it with someone you care about. A friend, a parent, a neighbor. You might save their life too. And don't forget to subscribe for more senior health and safety tips that empower you to live strong, independent, and wise. Because at the end of the day, your heart has carried you through a lifetime of memories, and with the right knowledge, it can carry you through many more.